We are going to start with the latest on the coronavirus situation in South Korea, though. We are going to have an overview of South Korea's progress tackling the virus and also discuss the situation as it stands around the rest of the world.
To update us on the latest, we have our COVID-19 correspondent, Yeon-seung, here with us in our studio. Yeon-seung, good morning.
Happy to be here.
Now, Yeon-seung, let's start with the current situation in South Korea.
Well, to start with the numbers, health authorities logged close to 1,400 new COVID-19 cases until 9 p.m. last night. This number is expected to climb to around 1,500 when the authorities round up the total tally for Friday morning. As for vaccinations, the latest reported rate stood at 67.4%, and authorities say that there are about 1.35 million people left to be jabbed in order to reach that 70% in terms of people who are fully vaccinated. Health authorities are really giving that last extra push for vaccinations to reach that milestone. So for people who've missed their dates for their second dose, it's now possible for them to just head over to their nearest vaccination center and get the jab on the day of. They just need to check to see if the center has any leftover doses, and they're good to go.
Yeah, I don't know about you guys, but I keep getting messages on my phone every other day about the vaccine. But let's talk more about this Living with COVID-19 scheme in South Korea. It's due to start in a matter of days now.
Right, you're absolutely right. Authorities are charging ahead with the Living with COVID-19 plan as of now. They're holding a public hearing next Monday to reveal a part of the first draft of the Living with COVID-19 scheme. They're also soliciting feedback on ways to ease social distancing measures while staying vigilant about stopping the virus.
Well, that is very exciting to see that we're going to see the end of this social distancing measures. But do you have any idea on what we can expect?
Well, there's really no way to know the specifics of the plan before health authorities give out the details, but maybe we can deduce some of the specifics from looking at Japan's case right now, because they're one step ahead of us in terms of social distancing. So they've been seeing a very significant drop in cases nationwide, especially in the capital city of Tokyo. And Tokyo has been reporting cases less than 50 for 5 days straight. So for some of the most populated cities in Japan, Tokyo and Osaka, they're pulling all restrictions in terms of operation hours and alcohol services in bars and restaurants, as long as those establishments meet the government-set requirements for COVID-19 prevention. There's still a 4% limit on the number of people who can sit at the same table. So they are taking prudent steps as of now.
Yeah, you seem so impressed with Japan's response and what's going on in Japan. You're lost for words. But it really is interesting because prior to the Tokyo Olympics, of course, we were talking about the explosion of cases in Japan, and such a U-turn is quite extraordinary. So a significant plunge in Japan, but what about the rest of the world?
Right, so cases have been on the decline for the rest of the world for 7 weeks straight now, which is very impressive. But some of the countries have been seeing a rather unexpected surge in cases. For example, the UK, they've topped 50,000 cases for the first time in 3 months. There's even this new variant in the UK that's been spreading, and it's spun off from the Delta variant, and it's sparking concern over whether it's more transmissible and more unresponsive to the vaccine than the Delta is. This variant was also detected in Israel, so authorities are very concerned about that. Russia is seeing record deaths and cases, and President Putin actually recently ordered a 9-day-long shutdown in workplaces. Singapore's health system is overwhelmed with a majority of their isolation rooms and ICU beds filled. The World Health Organization's emergency director, Mike Ryan, said on Thursday that increased indoor social mixing that could have followed from after the social distancing measures were lifted could have contributed to the surge in cases, especially in many European countries. Speaking of the WHO, I want to quickly mention that they released a grim report on Thursday. They estimate this virus could have killed 80 to 180,000 healthcare workers between January last year and May of 2021. And to really curb that number from climbing even higher, it's imperative that COVID-19 vaccines reach health workers in low-income countries as well.
We certainly hope that the figure gets lower as the time goes by. Now, Yeon-seung, thank you for that report. I will talk to you again later in our midday newscast.
Thank you.